Sharing Christ, sharing life, Blessed Hope Broadcasting Services.
Good evening. My name is Grace Oluwafemilayo Adesina. I want to take this time to welcome you to the 14th Annual Believers Convention of the Blessed Hope Seventh-day Adventist Church in Dartford. I will be doing the health talk for this Believers Convention, and my first topic is on anemia. I decided to do anemia, this topic, because we are coming across a lot of people with this condition in the clinical area. Sometimes they do not know they have it. We pick it up at times during a routine random blood check. And anemia can be very detrimental to health. And it can also be a symptom of something very serious happening in the body as well. Second reason is just to make people aware about how to manage anemia and how to effectively use the medication given so that we can get the utmost benefits. Anemia, the deficiency of healthy red blood cells, hemoglobin, in the blood. Red blood cells are essential to carry oxygen around the body. Heme is a ring-shaped iron-containing molecular component of hemoglobin, which is necessary to bind oxygen in the bloodstream. Oxygen cannot circulate on its own, as it needs to bind to hemoglobin to form oxyhemoglobin in order for it to be circulated around the body. In a case where oxygen alone needs to travel around the body, we have what we call air emboli, which can be very fatal to the body. But in most cases, oxygen binds with hemoglobin for it to carry it around the body and to supply nutrients. Hemoglobin for men should be between 13 to 18 grams, or 8.56 to 11.17 millimoles per liter. For women, it's supposed to be 12.1 to 15.1 grams, or 7.51 to 9.37 millimoles of liter. For children, 11 to 16 grams, or 6.83 to 9.93 millimoles per liter. And pregnant women, 11 to 14, or 6.83 to 8.69 millimoles per liter. What are some of the symptoms of anemia? Fatigue, weakness, pale skin, cold hands and feet, dizziness, reduced immunity, which makes us more prone to infection, and shortness of breath. What are some of the signs in children? Pale skin, fatigue, slow growth and development, poor appetite, decreased size of testes, behavioral problems, abnormal rapid breathing, and frequent infection. What are some of the causes of red blood cell or deficiency or anemia? It's as a result of reduction in production of red blood cell, as in megaloblastic anemia. Also, it can be due to excess blood loss, due to external bleeding caused by trauma, internal bleeding like worm infection, excess bleeding during period, long-term use of drugs like aspirin or analgesia, destruction of red blood cell, which we call hemolytic anemia, autoimmune conditions like rheumatoid arthritis, systemic lupus erythematosus, kidney failure, because red blood cells are also produced in the kidney, chemotherapy, because when we have chemotherapy, we're using it to destroy cancer cells. It also destroys normal cells. Bone marrow problems, because red blood cells are produced in the bone marrow. Any defect in the bone marrow might inhibit red blood cell production. And abnormal hemoglobin, as in sickle cell. We also have a condition where we have high hemoglobin. It's the increase in the numbers of sizes of red blood cell called polycythemia, which can be caused by congenital heart disease, pulmonary fibrosis, high altitudes, smoking, dehydration, advanced lung disease, and certain tumors. What are risk factors? Malnutrition, because of a low iron diet, vitamin B12, and folate deficiency. Problems in absorption of nutrients due to conditions like Crohn's and celiac disease, lack of balanced diet during pregnancy, and a family history. Complications. Anemia, if left untreated, can lead to severe fatigue and can interfere in daily activities. Anemia can also cause problems or complications in pregnancies due to folate deficiency, and this can include defective development of the baby and premature delivery. Anemia can also result in rapid or irregular heartbeat due to the heart having to pump blood faster around the body to supply oxygen and blood. This can lead to increase in size of the heart because the heart is working over time, and can also cause heart failure. Few of the causes of iron deficiency anemia can be megaloblastic anemia, can be prevented by consuming diet rich in iron, consuming vitamin B12 and folic acid, increasing intake of vitamin C since it helps in the absorption of iron. Avoid tea and coffee as it inhibits the absorption of iron from food. Avoid consuming iron blockers, that is folate found in whole grain, legumes, and nuts. Avoid oxalates present in spinach, beet greens, and rhubarb. Cooking these foods can reduce the amount of oxalates in them. We can also avoid polyphenols found in tea, coffee, and red wine. We choose fermented food instead. Avoid calcium-rich food as in milk with iron tablets because calcium competes with iron for absorption. That is why, as a clinician, when I give out iron tablets to people, I tell them to avoid this food, maybe eat them and use the iron tablet 2 hours after consuming them, or when we have the iron tablets, not to eat this food until after 2 hours so that iron can be richly absorbed. We can also include vitamin A and beta carotene found in orange and yellow fruits and vegetables. This also supports iron absorption. Cooking legumes thoroughly, that is beans and legumes. This improves the iron bioavailability. When we talk about bioavailability, we're talking about the concentration of a drug or a substance in the body, in the bloodstream at a given time. Foods that are rich in iron. Liver, although we need to avoid liver in pregnancy because it can be toxic. Red meats, beans, nuts, dried fruits, soya beans. Vegetarian foods that are rich in iron includes lentil, soya beans when cooked, white beans, pine nuts, cashews, broccoli, Brussels sprouts, kale, fermented natto, flaxseed, pumpkin seed, sesame seed. Note, very important. For vegetarians or vegans, the recommended daily allowance of iron is 1.8 higher than non-vegans and vegetarians because the iron in plants does not absorb well in the intestine as well as the iron from animal products. So when we are vegetarians and vegans, we should ensure or intentionally make sure that our diet is high in iron and utilize all these foods that are very high in iron to be able to have adequate supply. Thank you. God bless.
Sharing Christ, sharing life, Blessed Hope Broadcasting Services.